Well, my name is Travis. I'm from Columbia, South Carolina, and I've had chronic ankle pain in my right ankle for approximately 4.5 to 5 years.
What were your first steps to try to fix this pain?
My first step was to go to the doctor. He told me it was an ankle sprain, so I immobilized it, got a boot, then started, after the swelling went down a little bit, I did the RICE method, rest, elevation, compression, ice, stuff like that. And then I started exercising it, and it never really went away. Every time I'd walk, it would just hurt me, so it prevented me from wanting to go out. And then I went to the doctor again, and they did some MRIs, and it showed that I had lost a lot of cartilage in my joint, so there was a lot of bone-on-bone rubbing. They said there's pretty much nothing they could do about it. They said my alternative would be ankle fusion, and with that I would have limited mobility in my ankle, and I didn't want to go down that route because I figured that there had to be other solutions out there.
So tell us how athletic you are. You're a college athlete in a big SEC school. Do you work out every day? Like, how important is it to you to have use of your ankle?
Being an athlete really isn't that much important to me. I've graduated from college, but staying healthy really is. I mean, I like to go out with my friends. I like to do outdoors activities. I enjoy working out every day, and I enjoy feeling good. And when you're walking and your ankle bothers you, it can kind of bring your mood down. And sometimes my mood is dictated by if my ankle's feeling good that day or if it's not. If it's feeling good, I want to go out and do stuff. If it's not, I want to stay at home and not really do too much. So I'd much rather just have to open my options of going out and doing stuff, so that if my ankle feels good all the time, I can do that.
That's awesome. And so how did you injure your ankle?
Honestly, I'm not entirely sure. It basically just started hurting really badly one day when I landed on it wrong, and it just never felt good after that. When I was younger, I used to do a lot of jumps and stuff, and I think that kind of messed up my ankle, and over time it just wore down with ankle sprains from sports, and then it just started hurting one day and never went away.
Can you tell us, how did you find Dr. Schwartz and what made you come here?
Well, I was looking online, a lot of forums for people that have been dealing with chronic pain. I thought it was like ligament pain and joint pain, which is what the doctor also told me. So I was looking at regenerative medicine, ways to regrow your ligaments, ways to regrow cartilage, because I mean, it's not natural to deal with this, and I think that there has to be people out there on the forefront of researching it. And I discovered Dr. Schwartz when I looked into prolotherapy as a way to treat my ankle injury. And then from there, Schwartz introduced me to other methods that existed, such as PRP and stem cell treatments.
Tell us about the PRP. Why did you decide to go with that method?
Well, I tried a couple of treatments of prolotherapy on my ligaments, and I think it helped kind of strengthen them, but I was still having pain, and a lot of the pain was as a result of my joint being, having very little cartilage left. And Schwartz suggested that PRP would be the next step to take if prolotherapy didn't work. So I wanted to try PRP, to see if some of the growth factors in it would help regrow my joint, or even keep strengthening the ligaments and tendons around the joint to kind of take the pressure off of it.
So is this the first time you're getting PRP?
I've had PRP done once before on the right side of the outer side of my ankle, and it kind of strengthened it, but now I'm getting it done on the inner side and also inside of the joint. So hopefully, instead of working on the hinge, we're going to work inside of the hinge this time.
Nice. So what do you suggest to other folks with chronic pain?
Other folks with chronic pain, I'd suggest, don't give up on it. Your health is very important. The sooner that you notice that pain is starting to become chronic, you should start looking into alternative treatment options for it. I think prolotherapy would be a good start, and that could end your pain. But if that doesn't work, there are other options like PRP, stem cell treatments, and I'm sure as medicine gets better, then more advancements will come to play. So don't do anything permanent to yourself like fusion. anything that can't be undone, anything that's going to permanently limit you and doesn't have a very high success rate. Instead, just try to manage it to the best you can, and hopefully one day you'll find something that can cure it.
Awesome. And tell us a little bit why you like Dr. Schwartz.
I like Dr. Schwartz because he hasn't given up on me. He really encourages me. Not only is he treating me like physically, he also helps me deal with the emotional effects of dealing with chronic pain, because he's also had some issues with chronic pain in his life, and he understands firsthand like how it can affect not only your lifestyle but your mood and how you feel. And he's really supportive, and I know that he's always given his all to help me overcome this, and any new options, any new treatments that he has, he's always telling me about them, and he wants to see me get rid of this, so that's why I like him.